Good morning, bon matin.
Bonjour.
This morning's very exciting session. C'est un plaisir pour moi de présenter une session.
It's a real pleasure for me to facilitate this very interesting session this morning.
Valerie Gideon. I'm Mi'kmaq from the Gaspé-Gag First Nation in the Quebec region, and I'm currently the Senior Assistant Deputy Minister of the First Nations and Inuit Health Branch at Indigenous Services Canada, where I have some pretty fantastic responsibilities of trying to advocate and advance for addressing health inequalities among Indigenous populations across Canada. The topic of today's session is actually finding health equity for First Nations children. Also something, of course, that's very dear to my heart, being the mother of two First Nations girls. And en français, ce sont les inégalités.
So, inequities in matters of health among First Nations children.
Morning, beautiful territory, and I would like to encourage everyone to also acknowledge and respect the land on which they are on this morning. Nous allons commencer par
We will start by thanking the Public Service School of Canada for hosting this morning's session.
This session. We started the development of this several years ago at Indigenous Services Canada with an expert advisory committee that I had the privilege of co-chairing with Dr. Cindy Blackstock and First Nations experts across the country to support the implementation of very significant rulings of the Canadian Human Rights Tribunal relating to Canada's discriminatory treatment against First Nations children. And we felt that it was important to invest in learning within the public service about Canada's history, but also to look at the evidence and to see how we can apply it in making change within the public service as public servants. Alors, c'est une session très intéressante.
So this will be a very interesting session. We have distinguished guests amongst us. Thank you to the Public Service School support team.
Put this together, Edmund Roy, Ishedi Hailu, Danica Elliott, and also Robin Buckland. To start, I will just remind you of a few technical tools that you can use to facilitate your participation in the session today. If you can please turn off your virtual private network if you are within the public service and have access to that. There is also simultaneous translation that is available. The PowerPoint presentations of our guests will be displayed in English only. However, les versions françaises du matériel.
But the French versions are available, and you can ask for these at the school. We also have bilingual versions of the Pan American Health Organization's report
That are available online and will be the topic of Sir Michael Marmot's presentation. I will now introduce our prestigious guests today. I will start with our wonderful elder Verna McGregor from the Algonquin community of Kitigan-Zibi and Anishinaabe. Verna works at Minnewacan Lodge, which is the Aboriginal Women's Support Center located in Ottawa. Services provided by Minnewacan Lodge assist in the empowerment of Aboriginal women leaving violence, and Verna has remained firmly grounded in her community and nation by also being part of a group of traditional grandmothers and elders. This includes promoting the retention of the Algonquin language and culture, which is so important when addressing issues and connection to the land. I would also like to introduce Dr. Cindy Blackstock, who is a member of the Gitskan First Nation with 25 years of social work experience in child protection and Indigenous children's rights. Dr. Blackstock's research interests are Indigenous theory and the identification and remediation of structural inequalities affecting First Nations children, youth, and families. She's an author of over 50 publications and widely sought after, which is why it took us 2 years to be able to do this today. Even the logistical scheduling of these amazing people. She has collaborated with other Indigenous leaders to assist the United Nations Committee on the Rights of the Child in the development and adoption of a general comment on the rights of Indigenous children. And recently, she has worked with Indigenous young people, UNICEF, and the United Nations Permanent Forum on Indigenous Issues to produce a youth-friendly version of UN DRIP and the United Nations Declaration on the Rights of the Child. I will now introduce Sir Michael Marmot, who is Professor of Epidemiology at University College, London, Director of the UCL Institute of Health Equity, and past President of the World Medical Association. Professor Marmot has led research groups on health inequalities for over 40 years. He chairs the Commission on Equity and Health Inequalities in the Americas, set up in 2015 by the World Health Organization's Pan American Health Organization. He was chair of the Commission on Social Determinants of Health, which was set up by the World Health Organization in 2005 and produced the report entitled Closing the Gap in a Generation in August 2008. Welcome to our guests. And with that, I will turn it over to Elder McGregor to open our session today.
Oh, miigwech, Valerie. I just lit my smudge to everybody. I say, Kwekakina. Hello, everybody. I'd like to welcome everybody for Sir Michael Marmot. I'd say, welcome to Turtle Island. Why do we say that? Is because consider North America, Turtle Island, we call it. And if you look at it from the satellite view, the North America is shaped like a turtle, and that's tied to our original teachings as well. So, and I welcome you to Ottawa, from where I'm speaking to you from. And I always talk about the significance of Ottawa because we as Algonquin people, we're known for the rivers. So I'd say, Kwekakina Vernon Dishnikas, Kidagonzibin and Doje Bawa, Vishnido, Damashijunum Kipanesi. I say I'm from Kidagonzibi. My name's Verna, but I say also Wagashnido, Damashijunum Kipanesi. Fox is my clan on my mother's side, and Onumki Panesi on my father's side. Why do we say that? Is because we were known as a river people, and we had big territories. We're known as the Mamaninawak, the nomads. And why did we have big territories? Is because it's that understanding of sustainability that if you stayed in one place, you overharvested resources. So the significance of Ottawa is that you have the confluence of the rivers coming together from the four directions. You have the Gatineau River, we say Tanagadinsibi, coming from the north, the Ottawa River, which is Kichizibi, coming from the west to the east, and the Rideau River, which is a funny river. It's a north-flowing river coming from the south, similar to our little medicine wheel here, if you ever see this in First Nations communities. And at the center of that, in Ottawa, that represents a chaudière, but I find that interesting because there's many teachings to that with the four directions, the four seasons, the balance, mental, physical, emotional, spiritual, the balance of and at the center, we always strive for balance. So it's interesting that the rivers coming together is similar to the central. We'd meet here in the summer and talk about what's going on the lands, and talk about it. For example, if a hunter passed away, how are we going to look after the women and the children? And the well-being of everybody, of the collective. So I find that interesting today that Parliament, the nation's capital, is also situated at the central location, as all the federal headquarters, including Health Canada. So on that note, I'm going to send just a little opening prayer. I have a virtual tobacco that Valerie sent me, miigwech. And I have a little smudge going here. And usually when we start our meetings, everybody would smudge. So I'm sending you a virtual smudge. This is my eagle feather. Why do we smudge? It's a cleansing of your energy, but also a reminder that you see good things, you say good things, you hear good things, you do things with a good heart. But it's also a reminder that we come here to focus on what it is we're coming together and to learn from all these intelligent guests, our honored guests today. So on that note, I say, onjeni kashkito chama ndo se konshi nongo mwame kakina pamad sichik shuen mishnoni na bigis Miigwech kakina kakisha dano mam de gain in the kimena shkai kikwajin kaso in the kimena. We do kakia kakina kuch pemats chiktinag do abdan ya kakina kuch in the kimena mam de gay nishna be. Miigwech ya na say when kagimishin chimino upchitoyan chimino pematsiyan. We do kakia kakina pematsik mam de gay ya COVID-19 is in casa kan mama alkasuin. Miigwech ya kakina nebi pang si bisa gan shich kichiga. Miigwech ishkude kagimishin chimino upchitoyan. We do kagin in what chimishkal so I don't nagdo amanya kakina guchia ishkude. Kanshishkwat nigwe de simen kego gishimon dash is on and not question nigwe de simen. We do question and abicus we do kwa kakina pamasich ken abicus. Miigwech miigwech. As miigwech is thank you, and I say thank you, Creator, for allowing us to come together and to learn today too as well. And please guide our relatives well here as we come together. Thank you for the air, the water, the earth, and the fire, because all the four elements that are relevant for all life, to sustain life. And thank you for all our relations. And please guide us well, and we don't ask things in vain, and that we learn good things today, especially too as well to help the people who are going through sickness, such as the COVID-19. And we don't, I ask our relatives to guide us well. Then I said, miigwech, 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 miigwech 4 times to honor the 4 directions of the medicine wheel. So miigwech, and I hand it back to you, Valerie.
Thank you very much. Miigwech, 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 Elder McGregor. We will turn it over now to Sir Michael Marmot, and Sir Michael will share his presentation on the screen. Welcome, and thank you so much, Sir Michael Marmot, for taking the time to speak to Canada's public service today. Sir Michael, we can see the presentation. We're just not able to hear you yet. If you could unmute your line.
What about now?
This is fine. Thank you.
Good. I'm not going to talk about First Nation children. I'm sharing a panel with my friend and colleague, Cindy Blackstock, and I can think of no one better in the world to talk about First Nation children than Cindy Blackstock. So I'm going to talk more generally, and I'm going to use the example of the UK and ask you to translate. I don't mean into French, but translate into the Canadian context. So, global health equity and the pandemic. To start with, as you've said, Cindy and I were on this commission of the Pan American Health Organization on equity and health inequalities in the Americas. And we produced our report just 1 year ago, Just Societies, Health Equity and Dignified Lives. A lot has happened since we produced our report. A pandemic has come upon the world. And we said right at the beginning, quoting Nelson Mandela, overcoming poverty is not a gesture of charity. It is an act of justice. It's the protection of fundamental human rights, the right to dignity and a decent life. This was the conceptual framework of our Commission's report. We deal with structural drivers, political, social, cultural, and economic structures, the natural environment, land and climate change, history and legacy, and ongoing colonialism and structural racism. And those in turn impact the conditions of daily life. We had 7, 3 structural drivers, and 2 mechanisms for taking action, governance and human rights. And we took an approach emphasizing intersectionality, looking at social and economic inequities, gender, sexuality, ethnicity, disability, and migration. And the outcome was health equity and a dignified life. This is from the Human Development Report from UNDP that have produced a special report on COVID-19 globally. There's transport injuries, HIV/AIDS, self-harm, malaria, and COVID-19 deaths. Wow. It's just loomed so very large in a very short period of time. As you'll know, the Human Development Report focuses on the Human Development Index, which combines life expectancy, education and literacy, and economic progress, gross national income. And this is the Human Development Index globally. In the global financial crisis of 2008, there was a drop, and then it picked up. Then it was dropping a bit. And this is the predicted effect of COVID-19 globally. Enormous. And it makes the impact on human development of the global financial crisis of 2008 minor compared with the impact on the world on human development of COVID-19. And they produce the example, the Human Development Report people, of an external event, in this case, Hurricane Maria, which impacted on Puerto Rico, and the excess deaths. And excess deaths in the lowest socioeconomic group, the medium socioeconomic group, and the highest. And the point is that an external threat, be it a hurricane, be it an earthquake, be it a pandemic, does not affect the population equally. We get these increased inequalities. Quoting Albert Camus, and he said it better than I, but the pandemic reveals, in Camus' words, the hidden corruption of society. In my words, the pandemic exposed the underlying inequalities in society and amplified them. And that's what we saw with Hurricane Maria, and that's what we're seeing with the pandemic. The opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick. The healthcare system, of course, is vitally important in the pandemic. I'm not going to talk about that. We know how important it is. I want to talk about the conditions that made people sick. And I said I want to use England as an example. After the WHO Commission report in 2008, Commission on Social Determinants of Health, I was commissioned by the British government to look at how we could apply the findings and recommendations of the Global Commission for one country. And I produced what was known as the Marmot Review in 2010. And on the 25th of February this year, I published Health Equity in England, the Marmot Review, 10 years on. We looked at what happened in the last 10 years. My summary was, we have lost a decade, and it shows. If you look at life expectancy in England, this is from 1980, life expectancy was improving about 1 year every 4 years. In fact, if I took it back to 1890, for more than 100 years, life expectancy was improving about 1 year every 4 years. And in 2010, 11, there's a break in the curve. And the improvement in life expectancy just about ground to a halt. Question is, what happened in 2010? Well, we had a change of government, a conservative-led coalition government that came in with one overriding priority: austerity, reduce public expenditure. and they're obviously a bit sensitive, is what the government in 2010 prioritized the cause of what happened to health. Now, one question that got raised was, well, it's got to slow down sometime. We've got to reach peak life expectancy sometime. Well, this is annual life expectancy improvement in weeks between 2011 and 2017. And the UK had the smallest increase of any of these rich countries. Canada isn't on this graph, but Canada was better than the UK, except Iceland and the United States. And that's relevant because when we look at what happened with the pandemic, this is excess deaths. The problem with doing international comparisons of COVID-19 mortality, there are different ways of deciding whether somebody died of COVID-19. Excess mortality looks at the total mortality in 2020, in a given week in 2020, and compares it to what you would have expected in the previous 5 years. So the excess is the higher mortality in 2020 compared with the historical average for the previous 5 years. And England had the highest in the UK, higher than Scotland, Northern Ireland and Wales, and in fact the highest excess mortality of any European country. We hear a lot about how badly the US managed the pandemic. The excess mortality in England was higher than in the United States. Is there a link? We had up to 2020 nearly the slowest improvement in life expectancy, and now the biggest excess during the pandemic. And I think there is. I think we limped into the pandemic in a parlous state, ill-prepared to cope with what befell us. And part of that is inequalities. As some of you, I hope, know, I've been emphasizing the fact that inequalities aren't confined to poor health for the poor, although the poor do have poor health. This is level of deprivation of local area. But it's a social gradient. The less the deprivation, the higher the life expectancy for women and for men. The gap for women between the most and least deprived was 7.7 years, for men 9.5 years. But the gap's been increasing over the last 10 years. The inequalities have been getting bigger. And if we look at women by deprivation and by region, if we look at the least deprived decile, there's very little difference in the regions within England, and they've all been improving in life expectancy. If you are in the least deprived decile, if you're rich, it doesn't much matter where in the country you live. But if you're in the most deprived decile, if you're poor, it matters enormously. Life expectancy for women in the bottom decile improved in London and went down virtually everywhere else. So the picture in February 2020, before the pandemic crashed upon us, was stalling life expectancy, increased inequality, and life expectancy for the poorest women outside London going down. Not a good state at all. And then COVID-19 came along. If we look nationally at COVID-19 deaths, and all deaths, the gray is all deaths, the social gradient. In fact, it's almost parallel. I'll come back to this excess in a moment. But if the social gradient in COVID-19 deaths is similar to the social gradient in all-cause mortality, it means that the causes that we have identified of inequalities in health more generally apply to COVID-19. Now, I said I'd come back to this. This excess here at the very bottom is plausibly related to being employed in frontline occupations, drivers, care workers, subsidiary staff in the health service, and the like, and living in overcrowded multi-generational households. And we see a similar picture in Scotland, the social gradient for all-cause mortality and the social gradient in COVID-19 mortality. So the causes of inequalities in health and the causes of inequalities in COVID-19 are similar. That's why I say the pandemic exposed and amplified the underlying inequalities in society. And if we look at Black, Asian, and minority ethnic groups, if you look at women first, Black, British, high mortality, very high mortality from COVID-19, taking account of deprivation and some other factors, much of that excess can be attributed to deprivation. So you don't have to, as some commentators did, speculate about, well, is it something about being Black? And for males, similarly, more than half the excess can be attributed to deprivation. Bangladeshi or Pakistani, most of the excess is linked to deprivation, similarly for other groups. So we do have this excess in Black, Asian, and minority ethnic groups, and it's closely linked to being in more deprived circumstances. Now, in my 2010 review, we had 6 domains of recommendations: give every child the best start in life, education and lifelong learning. The third was fair employment and good work for all. The fourth one, crucially important, having enough money to live on. The fifth, healthy and sustainable places and communities. And the sixth was taking a social determinants approach to prevention. I said that the government came in with one priority in 2010, austerity. They said, we will reduce public expenditure. And by golly, they did it. In 2009-10, public expenditure was 42% of gross domestic product, and they brought it down. So by 2018-19, it was 35%. That's dramatic. We went from having a middling range of taxation in Europe to having a low range of taxation in Europe. And that drop in public expenditure really matters. And it was done in a regressive way. This is council spending per person. So by local authority, look at the dark grey. In the least deprived areas, council spending went down by 16%. And then the more deprived the area, the bigger the reduction. So in the most deprived area, the council spending went down by 32% per person. I showed this graph to an economist from the World Health Organization, and she said, you're making those figures up. I've never seen anything quite so regressive. Obviously, the greater the deprivation, the greater the need. And the greater the need, the greater the reduction in spending. So public spending was cut back, and it was cut back in a markedly regressive way. Did it work? The reason, supposedly, for all this was to make the economy recover. Wage growth between 2007 and 2018 was negative in the UK. The only countries that did worse of the OECD were Mexico and Greece. All these other countries, sorry, Canada's not there, but Canada included, did better. So it didn't work economically. I said I'd like you to translate into the Canadian context. So looking at children, poverty is defined as living in a household at 60% or less of median income. And housing costs make a huge difference. In 2010-11, about 18% of children were living in poverty before housing costs. After housing costs, it was 27%. And that 27% went up to 30% by 2017-18. Now let's look at housing type. For lone parent not working, 61% were in poverty, of children were in poverty in 2010. And 2017-18, 61 had become 70%. Work was supposed to be the way out of poverty. So let's look at a lone parent in full-time work. 18% of children in poverty in 2010 went up to 30%. That will damage children's lives. And then COVID-19. Food insecurity in households with children nearly doubled during the COVID-19 outbreak as food insecurity and insecurity due to supply issues. 2 million children were food insecure during the pandemic. Huge increase. We know that lockdown has a big effect. If you close the schools, then you're going to increase inequalities in education. So least deprived schools, most deprived schools, and teachers were asked to assess what happened to their pupils. So not behind, 1 month behind, 2 months behind in the least deprived schools. In the most deprived schools, children are far more likely to be 6 months or more behind, 5 months, 4 months behind. So closure of the schools has increased inequalities in educational outcome, which will again have catastrophic effects through the life course. And if we go back to the global picture, the Human Development Report classifies countries into low, medium, high, and very high human development. And this is the effective out-of-school rate for primary education before COVID-19 closure and during COVID-19 closure. So 86% of children in countries at low level of human development were effectively out of primary school during the pandemic. For very high countries, Canada and the UK among them, it was 20% effectively out of primary school. So you see these inequalities between countries. And look at this relatively simple solution. This is the effective out-of-school rate for primary education. So from 1970, it had been coming down very nicely. By 2018-19, more than 90% of children were effectively in primary school. The blue is what's predicted as the effective out-of-school rate with the pandemic globally. If there were no internet access, this is what would happen. Much higher out-of-school rate. And if you could close the internet gap within the human development group, in other words, the most deprived have the same access to the internet as the least deprived within that human development group, you could dampen the effective out-of-school rate. So a really simple solution, give internet access to deprived children, and you could improve their access to education. And when we look at spending in the pandemic, it's really rather important. What you see in countries at low, medium, high, and very high development, by wealth quintile, the possibility that people can come up with emergency funds during the closure. And not surprisingly, the wealthier people are, the greater the likelihood they can come up with emergency funds. And in fact, we know that people, particularly in the high-income countries with high wealth, don't need to come up with emergency funds because they've not been affected by the lockdown. It's down here where the effects of lockdown, even in countries like Canada and the UK, have been most marked. And the scale of fiscal measures related to COVID-19, direct spending, again, a country like the UK, we've had spending on furlough schemes. The higher the Human Development Index, not surprisingly, the greater the country's direct spending on fiscal measures during the lockdown, and the greater the availability of funds for loans and guarantees. This Social Progress Index was published last week, and I was so intrigued by it that I pulled off 3 countries. Germany, famously, has done very well in the pandemic. It's managed it well. USA and Brazil have managed it very poorly. And there are 16 indicators in the Social Progress Index, but I've chosen 2. If you look at inclusiveness, Germany is trending upwards, up and down a little bit, but essentially no change. The USA, after 2016, a drop in inclusiveness. I can't think for a moment what happened in November 2016, why that could have happened. And Brazil, that had its own version of the nightmare, had a dramatic drop in inclusiveness. And these 2 countries, the USA and Brazil, managed the pandemic very badly. And their Social Progress Index was stalling or getting worse. Another measure, an index of personal safety, flat in Germany and quite high. And again, goodness knows what happened in the US beginning in January the 20th, 2017, something might have happened. And the US decline in personal safety, and Brazil at a much lower level and a decline. And these countries managed the pandemic badly. So coming back to the UK, when I was making the link between the fact that our life expectancy improvement before the pandemic was slow and our excess mortality during the pandemic was high, we were ill prepared. And it comes back to the inequalities within society. Let me make one more point before I close. In my 2020 report, we looked at air pollution, PM10 concentration, higher in the most deprived quintile compared with the least deprived in these English cities. And we want to bring the climate change and health equity agendas together. We said this in our PAHO report. The details don't matter. Let me finish then with this. A well-being approach can be described as enabling people to have the capabilities they need to live lives of purpose, balance, and meaning for them. Where might I have got that quote from? Amartya Sen? Yeah, could be. But no, it was the New Zealand Ministry of Finance, the New Zealand Treasury. At the heart of economic policy was a well-being approach which can be described as enabling people to have the capabilities they need to live lives of purpose, balance, and meaning for them. As we emerge from the pandemic and think about building back better, we need sustainable health equity, and we should put at the heart of our policies a well-being approach. People should have the capabilities they need to live lives of purpose, balance, and meaning for them. Thank you.
Thank you so much, Sir Marmot, for that very provocative presentation. Also very relevant, very much at the core of what people are experiencing today, and especially in the public service where we're being asked to provide advice continuously with respect to where Canada needs to go in terms of Build Back Better. I think that this evidence and these metrics that you've provided us will be extremely, extremely valuable. I will now turn it over to Dr. Cindy Blackstock, who will speak about Spirit Bear's guide to why equity matters. And Cindy, I'm going to turn it over to you. Thank you so much.
All right. Well, good morning to everyone. And I too recognize unceded Algonquin territory and the elders opening this morning. Thank you, Valerie, for the invitation. And thank you, Sir Michael, for the privilege of having worked on that commission. I really learned a great deal about the importance of equity. And let me just start about what my own personal journey was in this. I started in child protection in the early 1980s in northern BC and then later in Vancouver. The district that I work in Vancouver had the wealthiest neighborhood in Canada, that being the British properties in West Vancouver. It had some of the most poorest areas in Vancouver, including a lot of refugees and immigrants from Iran and Iraq in those days, and then also the Squamish Nation. Although child welfare laws and patterns are supposed to apply equally to everyone in society, I found that when I was doing child protection, it was a rare case indeed that I'd find myself in the British properties. Far more frequently, I'd find myself in the poorest neighborhoods or on reserve and in the poorest house on the block. It was child welfare's law was really, in effect, codifying structural discrimination as a personal deficit. And yet the system itself was saying, well, let's cure this by providing more parenting. It must be the parenting skills of the parents that aren't up to par. Or we'll provide some parent-teen interventions. And although those can be effective interventions, when you're living lives of inequality, they really don't go very far. And what I had not really appreciated in early part of my career when I was working off reserve is how profound the inequalities on reserve actually contribute to the overrepresentation of First Nations children in child welfare care, in juvenile justice, in poor health outcomes, etc. So we'll just go to the next slide. In our report, on the Powell report, we were privileged to hear from Indigenous peoples all over the Americas. And one of the definitions of colonialism that really came to me was this one by Eduardo Galeano. It's published in the Powell report. It says, blatant colonialism mutilates you without pretense. It forbids you to talk, it forbids you to act, it forbids you to exist. Invisible colonialism, however, convinces you that serfdom is your destiny and impotence is your nature. It convinces you that it is not possible to speak, not possible to act, and not possible to exist. In many ways, the inequalities that First Nations children experience are of that invisible nature. You have to look for what isn't there. And when I went across the reserve line, not only did I find cross-cutting deficiencies in public services being provided to children and families. And I also found an absence of the voluntary sector. So in Canada, about 60% of funding for voluntary organizations or nonprofits actually comes from the federal and provincial government. And yet there are very few examples where those supports that are so desperately needed in many First Nations communities are provided. So you have underfunded services compounded by the inequalities in the voluntary sector funding. So what happens is that we end up with the cascade of disadvantage that First Nations children experience. And I want to just emphasize for us that these inequalities have been known in Canadian history by people who have worked in the federal public service for at least 113 years, likely look further back than that. But this is a report by Dr. Peter Henderson Bryce, who is the Chief Medical Health Officer for the Indian Department. He came to the role with the background in public health. He was president of the American Public Health Association, well respected in his field. And he was deployed by Duncan Campbell Scott out to look at the health of First Nations kids, Métis and Inuit kids in residential schools. And what he found is that the death rates were just astounding. And one of the things that he equated it to is the people in Ottawa back that day were getting 3 times the amount of healthcare funding than all First Nations were across the country, or as he would call them, Indians. And he comes back to Canada and he says, remedy those inequalities and do things like not put sick kids with TB and with healthy kids, do so what we would now call social distancing, ventilate the buildings, all these things that we're learning to be so important in stemming the transfer of disease today. These were things that he recommended, but the government said, no, it's too expensive. And that prompted another Canadian back in the day, Samuel Hume Blake, to say that in that Canada fails to obviate the preventable causes of death, it brings itself into unpleasant nearness with the charge of manslaughter. So when we look at this and we think if Dr. Bryce had been heard back there in 1907, imagine the cascade of disadvantage that we would have avoided with First Nations children. And part of that, what isn't there, that silent colonialism, is this erasing of history that distances us from the idea that the reason that these inequalities perpetuate is because we don't have the answers. When you do a more deliberate search of the historical documents, you find that that completely is not true. And one of the things that we have gotten into a pattern of in Canada is apologizing for the past, but not really learning from it. So we have residential schools where we had the removal of children for the purposes of assimilation. And of course, we had Prime Minister Harper's apology and later the TRC on that. We also then had the 60s scoop, and now we're in the middle of this, where there actually are 3 times more First Nations children in care than at the height of residential school. But when we look at children in foster care, the average person thinks, well, it's because people don't have parenting skills. And sometimes that's true. But when you take a deep dive into the data on First Nations kids, we get to the inequalities that Sir Michael was talking about. Poverty, poor housing, substance misuse related to multi-generational trauma, as well as domestic violence. Those are the reasons that First Nations kids are overrepresented. And if you think of yourself as a parent, and those are the risk factors, you have to ask yourself, what do you reasonably have control over? What can you change in order to remediate the risk your child is facing? And on reserve, where there's sometimes no water, where there's overcrowded homes that perpetuate the types of disease conditions Dr. Bryce talked about in 1907, and Sir Michael just took us through that apply in 2020, we find that there's actually a very small caliber of risk factors that parents can effectively change on their own. The major risk factors driving the disadvantage are sourced in government action, both provincial, territorial, and federal government action. And unfortunately, child welfare laws codify all of the risk as a parental disability. So they go back to when I was beginning a social worker, walk into a case of neglect and provide parenting skills, but do nothing about the moldy house and the fact the family has no water. And this is a result of our inaction. So this is First Nations kids on reserve only. And these are the number of sleeps that First Nations kids spent away from their families between 1981 and 2017. That number is 78 million nights, or 47,749 and 267 years of childhood. Like, that is the price of waiting to remedy the inequalities. And these numbers build every single day. And this is just in child welfare. We could talk, I know Valerie's done a lot of good work on kind of the health of First Nations kids and also on educational outcomes. This cascades across. So waiting is a problem. And Canada's known about this, and we can see some of the reports here. So there's the national crime. We did a review in 2000 with the government. This is Patrick Johnson in 1983, and there's Spirit Bear with the TRC in 2015. And yet we have not got to a place in this country where we actually address the inequality as a huge injustice that it is, and a preventable injustice. I want to kind of remind you that when I was doing child welfare, I went to the poorest house on the poorest street. But even those families off reserve have more services than a First Nations kid on reserve. So when we brought the case on the Canadian Human Rights Tribunal, there were patterns that we saw in the documents that seemed to be getting in the way of good public servants being able to remedy the discrimination. And I wanted to share them here because it's something that Valerie and I and Edmund are working on to try and create some training and engagement sessions with public servants. The first is systemic discrimination. And systemic discrimination is that twofold view of colonialism that we talked about in Galeano's quote, the blatant colonialism and the invisible colonialism together. And we haven't really tackled the idea of systemic discrimination within the government of Canada in the way that it interacts with First Nations folks and Métis and Inuit arguably as well. And the type of language I would hear that would get in the way of people being able to address the systemic discrimination and the inequality were words like too complex. It's too complex to address the fact that only 35% of First Nations have broadband access in 2020. We be patient. We need to take an incremental approach. We can't change things overnight, or else you diminish or disregard the reports that are on the piece or codify the inequality at a community or family level. So all of that really got in the way of us being able to address the inequalities when we hear these words. And just for clarity, like when we think about complex, government does a lot of things that are complex. We negotiated a trade agreement with that person who took over the White House in 2016. I can't think of anything more complex than that. When we talk about internet access and people say, well, it's because you're too remote. Well, this International Space Station with a population of 6 has great access. So surely we can get good broadband access available to First Nations kids who are trying to learn in the middle of a pandemic. The other is dehumanization. And this doesn't happen intentionally, but it happens through the use of acronyms or referring to First Nations children as a file or those kinds of things. So it's very important that we remember that behind each of these statistics is a real child's life. And we have to really make the effort, particularly in a bureaucracy, to really remember that in our decision making. Focus on authorities versus evidence and legal requirements. I know within government, and I worked within government myself for 9 years, you have all of these things that are there for guidance, but they should never usurp the evidence. They should be, these policies and processes should be in concordance with the evidence, and they certainly should not usurp legal requirements. Mistaking process for outcome. So we made one step. But why should First Nations children have to wait for equality? It's been 153 years, and this drop-by-drop approach, step-by-step approach has not achieved equality. And we can see the government spraying money everywhere during COVID. I didn't even know we had all this money. But surely, if there is this money, then we can remedy these inequalities. And I'd really caution people against using words that diminish or overstate First Nations involvement in government policy. So sometimes we hear the word engagement, partners, discussions versus consultation. And I think it's very important that when government uses those words, that they define those words. And really draw back to the United Nations Declaration on the Rights of Indigenous Peoples and see if that's really reflected in those types of, that type of language. And then the other is rewarding conformity to bad ideas and punishing moral courage. I saw time and time again within the documents, good people calling attention to the injustice, promoting the solutions on the books and being punished for it. While those who were either going along with it or actually promoting bad ideas about the perpetuation of the inequality, too often were rewarded. And this is an example. So with Jordan's principle that many of you on the call know, with the sad story of Jordan River Anderson, who spent a number of years in hospital unnecessarily due to a jurisdictional dispute between Canada and Manitoba. Jordan's principle came out of that as his legacy, his spiritual legacy, and that was that First Nations children ought to receive equitable services when they need them. It passed through the House of Commons in 2007, but until the legal orders took hold, it really wasn't implemented until about 2017 in any strenuous way. In fact, there were systems in place that really stopped cases from coming forward, and those that did, the government found a way of not calling them Jordan's principal cases. So it was zero Jordan's principal cases between 2007 and 2017. And Valerie will tell you it's not due to need, because she's seen skyrocketing rates and people requesting it. But the people who said no actually received the Deputy Minister's Recognition Award. And I thought, I saw so many people that deserve that award who said, yes, we have to deal with it. We have to have the hard conversation within government about addressing the inequality. So I'd like to see government calibrate to really assisting public servants in addressing those inequalities. Here's another way that it kind of falls apart is when we look at partial measures and we try to mask them as actual full measures. So this is the amount that Canada spent on child and family services. You'll see 2015-16 things start to go up, and that's because of the tribunal decision that we had. If the graph was to continue, this would rise even higher. But as part of its defense, Canada said, back in 2005, the Wande reports, which were done with First Nations and Canada, recommended a rough increase of 69.7%. And look at that, we're right on target. But what Canada was doing is that they failed to recognize that what we were recommending isn't that type of increase in the prevention budget and in the budget to allow for service delivery. So when you looked at it apples to apples, the actual increase is only 39%. And that's why we're continuing to see so many kids go into care unnecessarily. So there's all kinds of reports about today. Unfortunately, Canada, according to UNICEF, among rich countries, was rated 25th in the world in 2017 in terms of how it does for all children. Just a couple of weeks ago, it released its 2020 report card, and we've now dropped to 30th. So despite all the good evidence that Sir Michael is pointing to in terms of identifying and remediating the risks to children and how important equality is, Canada overall is going in the wrong direction. We also still have perpetuation of these inequalities and a rationalization of them. And I think that we really need to collectively bring ourselves to a place where we say First Nations children are worth the money. No First Nations child in 2020 should be told you get less or you have to wait because of your race. And that's effectively what is happening in Canada. So how can we fix it? Well, this is a new report out by IFSD, and I need to give Institute for Fiscal Studies and Democracy. And it was done in partnership with First Nations and the Government of Canada. And what we found is even with the investments that have been made under the tribunal's orders, there's still a shortfall of a minimum of $600 million. But addressing all of those drivers that we talked about, that Sir Michael referenced to, are going to be critical to really promoting healthy families and reducing the disadvantage for First Nations children. And one of the other key pieces of this, and I know that there's the C-92 law on child welfare, I worry a bit about that because I think it takes a very narrow conception of child welfare and doesn't deal with the broad-based inequalities. But we have something for the Spirit Bear plan, and it was twofold. One is evaluate the Government of Canada so we find out why it doesn't do better when it knows better, and how to, in that, support those progressive public servants who are promoting a justice and evidence-based approach. The second is cost out all the inequalities that First Nations children experience, and let's deal with them in something like the Marshall Plan after the Second World War. It was adopted by First Nations unanimously in 2017, but the Government of Canada has not implemented it. So I'm going to leave it there. There's all these resources on our website. And to just thank Valerie and Edmund and others for the opportunity to share these thoughts today. And I'm looking forward to the discussion.
Well, thank you so much, Dr. Blackstock, Cindy, and also Sir Marmot. And you were right on time. So really appreciate that. I know it's not always easy when there's so much to say. But so well organized, so well planned, and extremely provocative questions or observations, I'm sorry. So if people want to ask questions, my understanding is that you can raise your hand using the MS Teams function, and we are monitoring that so that we'll be able to ask questions to our panelists. And as people are thinking about their questions, one of the things that we were thinking about is how can we leverage right now society's attention on the issue of racism and systemic discrimination? So we've seen a lot of coverage about that in the press, in the US, but elsewhere across Europe as well as in Canada. And part of that is lightly stimulated by what you've said, Sir Marmot, about how COVID has really laid bare the how inequities have really impacted the outcomes, health outcomes of individuals affected by COVID-19. But how can we leverage the momentum that's growing in the public now around racism and discrimination and the COVID-19 inequities that have been demonstrated to influence the government's approach to Build Back Better or to the economic recovery plans? Do you have any suggestions for us as members of the public service? I don't know, Sir Marmot, if you'd like to maybe start in terms of any thoughts that you have.
Well, I suspect that the average Canadian was not so different from the average white British in suffering from the illusion that we didn't have a racism problem. The United States had a racism problem. South Africa had a racism problem. But these nice British people and nice Canadian people didn't. And that was our illusion. And it was an illusion. And COVID-19 has brought home that we can't suffer that illusion any longer. So it has, now we need to grab the moment, because to go back to that comforting illusion would be tragic. So we need to grab the moment and say, to come back to Camus, the pestilence is both blight and revelation. The pestilence, COVID-19, is a blight, but it's a revelation. And we need to recognize that. Now, I have no magic wand for doing it, but I can tell you for the first time in the UK, there is now a health observatory related to Black, Asian, and minority ethnic groups. And I think it's no coincidence that it happened at the time of COVID-19. I've been involved in several seminars. I mean, when our government statistical office published the high mortality in Black, Asian, and minority ethnic groups from COVID-19, I was on BBC Radio, and the health minister was asked, what did he think? And he said, yeah, he was terribly concerned about this, and that Black people should wash their hands. And I was asked, what did I think? And I said, I was terribly concerned, and washing hands was a good idea, but we should deal with structural racism. Yeah, but what should we do tomorrow? Tomorrow, we should deal with structural racism. We should start right now. And so it is a moment. I can't answer your question about how we stop from going back to the previous way of thinking, but all of us who are concerned about health equity have to rally around. I mean, I was talking at my university this morning at UCL, and students asked me, remotely, but students asked, what do we do? And what we do is a university has to be part of that very important discussion about creating an equitable society. And it means all the dimensions of equity that I mentioned from our PAHO Commission. It means Indigenous, non-Indigenous. It means African descent, non-African descent. It means socioeconomic. It means sexual orientation. It means disability, no disability. And all of those groups on the wrong side of that divide are discriminated against. And it's unacceptable in a decent society. So we've all got to have our voices heard about how to build back better in a fairer, more equitable way.
Thank you very much for that, Sir Marmot. We do have a question that came in, but just before we go to that question, Cindy, I'm just wondering if, there's a speech from the throne coming up. You talked a bit about the Spirit Bear Plan, which, although you didn't mention it, just for people to say, it's like the Marshall Plan, after the Second World War, what was really required to rebuild Europe, right? And so the Spirit Bear Plan is sort of that equivalent, all-encompassing structural plan for addressing the systemic discrimination against First Nations children. And I just yesterday was hearing from Inuit representatives when we were talking about COVID-19 and all the short-term relief measures that have been put in place, the emergency response benefit, some of the food access that they've had, some of the funding that we've been able to provide families on multiple fronts during COVID-19. Their concern about people starting to really rely on that, even the on-the-land initiatives that we've put in place to support mental health or to support alternatives to confinement, and how families have really benefited from that and seen great benefits from that. What happens when it's going to be taken away? What happens when the pandemic will be deemed over and then people will have to go back to not having access to those supports? There's real concern that it's going to make things worse. So what is your advice to the decision makers in Canada now about what needs to happen in this speech from the throne and in future government initiatives to rebuild Canada?
I would just say that there needs to be an acknowledgement that systemic racism is happening in the government today. That's the first threshold. I hear too many politicians talk about it as a past thing, not something that's happening for First Nations, Métis, and Inuit today. The other thing is I would like to see far less use of the word Indigenous because it masks the different types of inequalities that people are experiencing. For example, First Nations are only subject to the Indian Act and only subject to the level of discrimination that was addressed in the Canadian Human Rights Tribunal. So by using this Indigenous word, we're actually homogenizing the concerns and masking the types of systemic discrimination that's in place. The third thing is that we really need to be able to address the inequalities and say to ourselves that we're going to do it and not make excuses and not be satisfied with partial measures. I have full confidence, given what Canada's done on the COVID, that it absolutely can remedy the inequalities. And I have that confidence because we've done so much work over the years to document those inequalities and to provide those evidence-informed solutions to address it. What the public needs to do is not excuse it and not allow folks to get away with the idea, well, we'll do what we can or whatever. We need to understand that history, that Canada has never treated First Nations children equally in 153 years. And that if we continue to be satisfied with these half measures, that discrimination will continue to perpetuate and we will continue to see the disadvantage. And I'd also say from an economic point of view, and we've made these arguments, that economically, it actually makes sense, better sense, to remedy the inequalities than to wait for a crisis and throw symptomatic measure money at people. First Nations folks want to live a dignified life. And one of the things that we do is we address those inequalities along with some of those other things that are in the framework of PAHO, like questions of land. It's not just climate change, which is a threat to human existence, is the way it's looked at. It's when the land is part of who you are. And how do you build that into a framework, into a holistic framework? I think the Spirit Bear Plan provides that opportunity.
Thank you very much for that, Cindy. Sir Marmot, we have a question for you. What implications do you see coming from the work of Case and Deaton on the deaths of despair? For one of your graphs where we see life expectancy stalling in the UK, what Case and Deaton show in the US is that life expectancy is actually falling for some groups in the USA.
Yeah, as I said, the only big country that had worse performance in terms of improvement in life expectancy than the UK was the United States. And deaths of despair clearly played a role. We looked hard at the British data, and so far we hardly see it. So the opioid poisonings we don't see. There's a little bit of a hint in Scotland among the kind of age groups that Case and Deaton looked at, 40 to 59, that kind of age group. There's a little bit of a hint of opioid poisonings in Scotland, but we don't see much of it in the UK. We do see alcohol-associated problems, and we do see suicides. And Case and Deaton talked very much about people who didn't have a 4-year college degree. But in fact, if you look at their data, it's a social gradient. It's not one group versus everybody else. The fewer the years of education, the higher the mortality from drugs, suicide, and alcohol. And it is closely linked. I mean, I like their analysis. I wrote a review of it for The Lancet. It is closely linked to the destruction of working class life. Now, I asked the question, well, why in whites? Why not blacks? If your hypothesis is correct, African Americans have been suffering from this for a much longer time than white Americans. Well, the way they answer that question is, yeah, that's right. And African Americans still have higher mortality than whites. But the white advantage has got less. So the kind of things we're talking about have huge impact for the whole of society. I mean, when a society is getting less healthy, it tells you something fundamental about the nature of that society. It means the society is doing worse. And when inequalities get bigger in health, it means inequalities in society are getting bigger. And that something that Cindy educated me about on our PAHO commission. You can't, she said to me, you can't look at Canada, as I was prone to do, and say, gee, Canada's terrific. It's doing so well. The life expectancy is good. Everything's going so well. And ignore the groups that are doing badly. That's a statement about a country as well. So just as deaths of despair in disadvantaged people you can't say, well, it's those working class whites who are killing themselves. The rest of us are okay. No, there's something wrong with society if you're getting a social gradient in these deaths of despair.
Thank you so much. Cindy, I have a question for you. How does Jordan's principle relate to treaty rights? Are they related? And this is a question that the public servant who posed the question is receiving in the West in particular.
Yeah. Well, one of the things that's not a treaty right is discrimination. And I think I've read the treaties and I'm pretty clear on that. And certainly when those treaties were written, my understanding of them is it was really done with a look at the multi-generational well-being of community. And that was a particular focus on children, the types of things that they would need to be healthy and well. Now, Jordan's principle is based on a set of legal principles that I feel are aligned strongly with treaty rights. For example, they're to be based on the needs of that child within the context of their distinct community. That is supposed to be substantively equal, recognizing the hardships of residential schools, 60 scoop, and these ongoing inequalities on families. So more investment may be needed for a First Nations child than for a child who has not experienced those disadvantages. That it also needs to be based on the best interests of the child, and best interest not from a Euro-Western centric point of view, but best interest as we tried to capture it in the United Nations Convention on the Rights of the Child General Comment 11 on Indigenous children. That's really a predecessor to UNDRIP, but certainly reflects a lot of the key principles of UNDRIP. So it is, however, as good as Jordan's principle is, we would have far fewer requests for Jordan's principle if those underlying inequalities I was talking about were addressed through the Spirit Bear Plan. If we address the Spirit Bear Plan, then Jordan's principle wouldn't be so essential. Jordan's principle, in some ways, is a stopgap measure because those inequalities exist. And what we're seeing during COVID is an up-ramp in the requests, and that makes sense. The most disadvantaged are going into crises and are needing more supports, and that's going to continue to happen. So I see it as being really related to that.
Thank you very much, Cindy. And one thing that I'll say, because we have a couple of years under our belts and we've had over 690,000 requests just really since 2017, as you've pointed out. As soon as we see a provincial government, for instance, cutting back funding, for instance, for education funding for provincial schools, we start to see hundreds of requests to Jordan's Principle for education assistance services, for instance, because the schools are unable to provide fully the needs of all children in that school that have that need, but they do come to Jordan's Principle as a mechanism to at least be able to more fully support those First Nations kids. So we see the immediate impacts. It's a real, it's an excellent vehicle for us to be able to see the impacts of any type of regressive, just using Sir Marmot's language, regressive behaviors on the part of a government with respect to public service that affects children in Canada, actually, overall. We have a question on how do we combat or begin to dismantle the tokenism that comes along with reconciliation efforts? And of course, Canada is not the only country that's made commitments with respect to reconciliation with Indigenous nations. We've seen some similar commitments in Australia and elsewhere. But, you know, from an Indigenous perspective or First Nations, Inuit, Métis perspective in Canada, you know, there are feelings that, you know, it may not necessarily lead to a sustainable entrenchment of change within not just the federal government, but we're in a confederacy sort of model or confederation model in Canada, so also provincial territorial governments. I'm wondering if one of you would like to comment about how do we get beyond tokenism when we talk about reconciliation?
Well, if I can give in recent years, I've made a few trips to Australia and engaged. I'm feeling chastised by Cindy. I was going to use the word Indigenous, but I don't know if that's inappropriate. I've just been chastised in advance. But with Aboriginal and Torres Strait Islanders in Australia, and the sort of mainstream rhetoric is the problem's insoluble. We've spent billions of dollars and nothing works. And I went to an Aboriginal community centre south of Sydney and talking to people. I've been to various community groups in Northern Territory, in Victoria, in New South Wales. And as one said to me, if you've had 200 years where you've been deprived of dignity and control over your lives, and then they throw a bit of money at you, it's not surprising that it doesn't work overnight. And it's simply to say, here you are, here's some money, now everything should be all right. A point that Cindy has made is you do need money. Money is vital. You know, if you don't spend the same amount of money on a First Nations child as you spend on a non-First Nations child, it's not surprising you get different outcomes. So you do need money, but money's not enough. And on a recent trip, I was told that for the childcare services in Australia, the question is not if an Aboriginal child will be removed from his or her parents, but when. The default position is we will remove children from their parents. And it costs about $100,000 a year to take a child into care. And I met with a group of community leaders, VACCHO, the Victorian Aboriginal Council of Community Controlled Healthcare Organisations, something like that, from different communities around Victoria. And I said to them, none of us thinks that it's a good idea to leave a child with abusive parents who are abusing drugs and alcohol and sexual abuse, physical abuse. None of us thinks that's a good idea. But for $100,000 a year, maybe you could work with the families and try and deal with the drug and alcohol problems and keep the children with the families. And one woman who's an Aboriginal woman, a leader of this community-controlled healthcare organisation, said we're doing it in her provincial town. We've taken on the legal responsibility for these children. We get the money, and we work with the families to try and keep the families together. So it means trying to understand the multivariable nature of the issue. And again, as Cindy has said this afternoon, and she said to me, and is in our PAHO report, the importance of relationship to the land, the importance of traditional cultural beliefs, and dealing with it in a sensitive, multi-varied way. So it does need money, but money's not enough. It's needing all of these other things. And it starts with how terrible it is to remove children from their families and put them in institutions.
Thank you so much, Sir Marmot. Cindy, we have a last question that I'm going to direct to you, and then we'll start with closing remarks. How can public servants overcome the perceived or real constraints, so partial remedies that exist in existing program initiatives? Now, you and I are working together now on reforming some terms and conditions. So you know all about the restrictive frameworks that a lot of programs are working in, that public servants are basically directed to implement. What advice would you have for those public servants?
One of the things that I really recommend people do is actually look at Robert Williams' book, Savage Anxieties, because he really talks about what colonialism means writ large. And it basically comes down to a savage and civilized dichotomy. And where everything that's First Nations, Métis, and Inuit would be savage, and everything that's not is civilized. And sometimes I see that actually emerging in a lot of government policy. With the amount of reporting, for example, when you do give a First Nation or First Nations expert group ability to run their own programs, the reporting is astronomical compared to a Western province. So we have to just be mindful of whether that dichotomy is actually investing in our public service. And we have to trust people to look after their own kids, is really what Sir Michael's saying. We've seen the results of not trusting First Nations families with their kids, right? There's been apologies, there's been lawsuits and compensation. We got to try it the other way. And the other piece I think that's really important is to emphasize the importance of control, but not control as in a dump. And that's what I'm kind of worried about C92, is that without remedying all those inequalities that make First Nations children more vulnerable, and we just transfer child welfare over, it's going to be very hard for First Nations communities to really achieve the success that they need for kids. What I would ask for each one of you is, if you have ideas on how to confront that you found successful, or even barriers that you've confronted in your work that have gotten in the way of you being able to implement UNDRIP or the tribunal decisions or the convention or the PAHO report, then let us know about them in a safe way. You can even email me at my private email address. I won't say anybody who you are. I'm sure Valerie would be open to getting those too, because we want to develop training that gets at the level of where those blocks are. The final thing I'll just share is kind of my own personal view. Is when I was in the public service, I sometimes put bars around what was possible. I assumed that you couldn't go past this policy or innovate in a new way. And what I found over time with good mentors is that you absolutely can do that these are really meant to be guidelines and not the law. And they certainly, whenever you have a policy that is not evidence informed, that is actually leading to harms to kids, then as a public servant and as a person, you have a duty to address that. And you can do that internally, you can go to ombudspersons, or you can go to civil society organizations so that your particular situation is protected. But I don't think any of us should stay silent in the face of ongoing systemic discrimination. The kids are relying on all of us.
Well, thank you so much to both of you. I think that this has been extremely provocative and very, very timely. I'd like to just remind everyone that the participants that registered will receive an evaluation questionnaire, and the Canada School really depends upon the retroactivity, the feedback that you provide them. Alors, s'il vous plaît, quand vous allez recevoir votre questionnaire,
when you'll receive your questionnaire, your electronic questionnaire, please provide feedback. Please take a few minutes to fill out the form.
At a school and sign up on GC Campus. There are a number of materials, including specifically relating to these issues, that are available to you. This session is being recorded and will be available also to the public through YouTube. Even though this session was restricted to the public service in terms of registration, there will be some public access. So please promote it across your networks as well. And it will be, of course, categorized also on the school's website. Et maintenant, thank you so much. I would like to invite Elder McGregor to share some closing thoughts with us today. Verna, over to you.
Thank you, Valerie. Thank you, all you wonderful speakers. I enjoyed listening to this, but also as a First Nations person I also live on reserve. I see, and the work that we do here, we see the relevance of all the discussion today and the importance of addressing the inequities because we see it frontline, but also I see it in my community. But going even 100 miles north from my community, we have fairly decent housing, but you're seeing third world conditions here in the next Algonquin communities. So I'm glad that my hat's off to Valerie, Professor Blackstock, and Michael for taking the time to come and share your wisdom. And on that note, so I'm going to just say again a little closing for everybody. And thank you. So I say, miigwech, kijemanido, onjeni kashkitoche mawandose, koshi no go mama kakina, pamatsajik, we do question in abigis, when mishnon in abigis. Keen ki depend on kakina guch, keen kimotion on kakina guch, we do go demogasajik, hen abigis, we wisnajik, a shit akasajik. Frances got nigwete simin kego, me miigwech. I say thank you for allowing us to come together here. Please help our relatives really and the work that we do. And thank you for the speakers. And always remember also too, as well, it's the creators in charge, and we don't ask things in vain. And also too, as well as a reminder, going back to our medicine wheel, that everybody belongs in the circle. And that's what we're trying to achieve here in terms of equity. So I wish you well and thank you very much. Miigwech, merci.
Miigwech, Elder McGregor. I wish everyone health and safety and this feeling of inspiration that you have now. Don't lose that. We need you. Miigwech.
Miigwech.